I believe I mentioned this before, but I had some reservations a little bit about, the time commitment and, to be honest, about the financial commitment of taking the course. However, both of those were really unfounded. I found that the once a week class time was very manageable. If I did have to miss a class, which I think I missed one or two, the makeup was really easy for that. And Karen absolutely had all of the material available for me on what I had missed. Because life happens. She knows that. She's very aware of that. The cost of the class was very affordable comparatively. There are some other advocacy courses scattered throughout the country that I had sort of researched, but for the most part, they're much more expensive and they don't offer the myriad of topics that are covered in the holistic registered nurse patient advocacy training program by far, really. Karen's course offered so many continuing education hours that it really was cost efficient for me to gain those through this course rather than taking them separately. And uh, Karen also she understands about the financial commitment part, and she gave pointers to all of us about how uh, we could afford the course. And in fact, I believe it was the first lesson covers like how, because one of the biggest questions for me was how on earth do you ever finance getting your own business off the ground? And I believe the first course was comprised almost totally of how to accomplish that financially. And had wonderful pointers, things I had no idea, resources I had no idea were out there in order to establish that. um, in addition, across the country, there's very little regulation on patient advocacy courses and training courses. As I've said, I think it's a new budding part of nursing, and Karen's is one of the only few that only allow RN and MD level providers to participate in the training course. There are always exceptions, but I don't understand how a person without those credentials would be able to navigate, the questions and the complications and the care planning that real patient advocacy requires, or even basic patient advocacy, because our system is so confusing. Um, but Karen is really great at instructing that. I've had the good fortune of knowing Karen for many years prior to taking the course. We both live in Asheville, and Asheville's healthcare community's historically been very tightly knit. And Karen was definitely a high profile player on that front. She's one of the most experienced and competent nurses I've ever known, and her skill set crosses many specialties, not just patient advocacy or holistic nursing. She's done many, many things. And I met her when she was a nursing director, and she was also branching into academia. She had already been making huge forays into holistic nursing when she began her patient advocacy practice. And I knew at the time when I heard that she was starting this business that I was witnessing a shift in our nursing culture and a skill set that was going to be badly needed with our aging population and the horrific nursing shortage that we had all predicted and was only exacerbated by the pandemic. And the pandemic itself also strengthened the need for holistic nursing and advocacy practices. As we witnessed the effects that it had on people, not just the patients, but their loved ones, and on us as healthcare providers. And Karen's course also focuses on that, not just taking care of them, but also taking care of us in order to be successful. Which most healthcare providers know we don't take a lot of time for ourselves, and that was stressed a lot in this course. And one of the great things about the course, and which helped in that and with other things, was Karen keeps the course down to 10 to 12 participants. And during the course, there were lots of breakout sessions. So you really, the first couple of sessions, no one knows everybody. You're starting to get to learn everyone. But there were breakout sessions that we had in small groups, and you get to know who's in your group and what they've all gone through and their skill sets. And um, I'm a very social person, but I don't necessarily always like that kind of stuff. Like when it was in my master's program, it was like, oh God, we have to do a group project. But this was far and away not like any of that. It was wonderful. We really got to share, you got to know each other, and I have made some very lasting friendships that will be with me for the rest of my life, I'm quite sure. The people I went through the course with, it's sort of like a brotherhood or sisterhood of people, and we meet regularly even since we've finished the course. So there's a big alumni group, but we meet as an alumni group also. So it's very personalized, and it was very pleasant to be able to interact with them, and I was looking forward to it every single week. And watching us all grow and change as we went through the course was, in particular, one of the best parts of the course. So, final thoughts. Even though I knew Karen, I did not know what a big force she was in this across the country and in other countries as well. We've had participants internationally. Um, so I was kind of proud to know her. I was like, I've known this lady for so long and she's been so wonderful, but I did not know that she really was forefront in her field. And the things that I learned in this course, I will take with me to my grave. I will certainly carry with me throughout my practice. But these skills surpass your practice. It's part of a life set. And being able to help people and advocate for them is really why I became a nurse. And having a business that allows a person to do that as part of their working set is just a tremendous gift that many of us aren't given. So I'd like to thank Karen and everybody that I got to be in the course with, and it was fantastic. So thank you, Karen.